Good morning. This is Cyndi, the Director of Clinical Affairs with EO2. I'm sitting here with Diana Boston. She is a licensed physical therapist, and we're doing Coffee with Clinicians. It's kind of a new segment for EO2. I have found that throughout my career, I've learned from a lot of different people. And I wanted to share some of those folks with you, and we'll be doing some more of these segments with other clinicians so that we can all kind of learn some experiences and get some new nuggets of knowledge. So with that, welcome, Diana.
Hi, thanks for having me.
Absolutely. So tell us a little bit about some of your background.
So I'm a physical therapist, and for the past probably, well, more than 26 years, my focus has been wound care. So 98% of my 26 years has been spent doing nothing but wounds. I kind of got started on the job when I was doing internships, found some really cool wounds and just really was drawn to the wound care, and had a position at a hospital where I was kind of filling in for 3 months and got submerged into wound care and just loved it and realized that there's not a lot of people out there that really truly know it, understand it, and specialize in it. So that started me on my path for doing a lot of continuing education and then getting my certified wound specialist and then eventually my certified lymphedema therapist.
So for those of y'all keeping count, she said 26 years. That means Diana started when she was 10.
Yeah, I was 9.
9. So I want to expand on that because a lot of people don't realize that physical therapy does wound care. And I actually got my certification and learned through a physical therapist.
Oh, wow.
Tell me how you think physical therapy can do other things that maybe folks like myself, like an RN, aren't able to do.
Well, in PT school, obviously we focus a lot on the anatomy and physiology of the body. We know all the origins and insertions of muscles and nerves, blood vessels, and we do go through cadaver labs. So we learn how to use scalpels, forceps to debride, to tease away, to see where all the structures are. And then in physical therapy school, we also learn how to use modalities in trying to heal patients. And, you know, ultrasound, electrical stimulation, whirlpools, the contrast baths. And I think whirlpools is kind of where more of the wound care just started because we were the ones that owned the whirlpools. But then again, we've learned all the physics and the physiology behind the modalities like ultrasound, electrical stimulation, and you know, obviously I went to school just a couple years ago, and since then, biotech has just blossomed, and we have all these new modalities that have come out on the market since then, negative pressure, and EO2, and our background in physical therapy is really understanding the physics and the physiology behind how a lot of these mechanisms work, and we are the ones that routinely would use those kinds of modalities.
So you mentioned that you were a lymphedema specialist,
Yes.
And I get to witness that firsthand. I've learned a lot from you. So tell me how that lymphedema is often correlated with wound care.
So I don't like to just classify it as lymphedema because I feel that that sometimes is a scary word for a lot of people because we think elephantitis and people just really don't understand lymphedema. But edema in general oftentimes goes hand in hand with wounds. And chronic edema that's not addressed properly can destroy the lymphatic system, and then you end up with a combination of chronic edema issues and lymphedema. So they go hand in hand. Anytime you get swelling, you get, anytime you get a wound, you'll get a little bit of swelling with it. Sometimes it's manageable, sometimes it's not. And if we don't address it, it congests in all that tissue, and it can actually kind of decrease your blood flow to the area because everything's so congested. It decreases the body's ability to clean up the area because all that stagnant fluid is kind of like a blocked sewer, and the lymphatic system takes it away and cleans it. So they go hand in hand, but the lymphatic system is so not, it's just people aren't taught a lot about it. Even doctors get about maybe an hour of lymphatics in their schooling. So
what are some of those misconceptions? Because I see that as well. Even myself, I've learned so much through working with you with lymphedema. And so what are some of the challenges in the medical world that we face besides lack of education, but also, you know, you might see people treating it incorrectly?
yeah. Lymphedema and chronic venous insufficiency and those kinds of edema, they're hard because they're not just a quick fix. They're long-term, and you've got to get a patient to buy into the fact that you've got to reduce the swelling before you get into a long-term compression garment, and that's a lifetime commitment, and it's not reimbursed by insurance for the garments and stuff that the patients have to wear. So it takes a lot of convincing because there's a lot of doctors and other clinicians out there that'll say, oh, just take a diuretic, or you can get a vein ablation and everything will be fine from then on. It's like, well, those might hurt, might help, but it's a long-term process, and getting the patients to understand it and getting those patients that need it to somebody who knows how to treat it is actually another issue, because I know there's lots of people out there that could benefit from compression and everything that goes with it. But
yeah, I
see,
we struggled even getting them home health care to get somebody who can see them in their home. And I know that's a struggle as well.
It's a very skilled discipline. There's so much more that goes into it than you can imagine. And there's so many products that are easy out on the market to just a disposable wrap here and there, Una's boots, all that kind of stuff that, it might temporarily fix something, but usually then it shifts the fluid to another area, and then we end up with bigger problems.
So with wound care, what are some successes that you've seen using CDO therapy?
The CDO therapy has been really impressive to me, and I pretty much open every new thing that comes on the market with a little bit of a cynical eye and just kind of go, okay. But the thing that I loved about the CDO is that it's a continuous diffusion of oxygen right to the area. So we had a patient who came to me who was in a pretty bad car accident, and she had developed some hematomas that were really large all over her legs and that were just sitting there and festering because the wound care where she wasn't adequate. So getting to be able to clean those up, compress, because she had some definite swelling issues going along with that. And then using the CDO in conjunction with cellular tissue products was really cool to see how everything healed. The patients get excited about using something that's so easy to kind of understand, just topical oxygen therapy, giving it right where you need it. And they get excited about being able to kind of own and work with us to help heal just by maintaining this unit and keeping it with them. I've had a sickle cell patient, and those are vascular issues, who's responded really well. It's helped with the pain. We had one young man with really chronic pilonidal cyst, went to Mayo Clinic, came to us kind of as a last resort, and we were able to use the CDO with him and heal him up after 2 years of having just this chronic cyst. So that was really cool.
And that's amazing, because we know in wound care that pilonidal cysts are super hard to treat. You can't get approval with negative pressure easily.
Yeah. So you can't sometimes even get a seal with negative pressure in that area.
Yeah.
There's a lot of issues to contend with.
And compliance, because they're younger, they don't want to carry a device that everyone can see and hear. And
education is key. Getting the patients to understand that you can't do this for them, that they've got to own it, they've got to watch their nutrition, they've got to watch their offloading, they've got to do the compression when it's appropriate, and they've got to come in for their visits and take care of their wound, take care of the health, and then maintain that after they leave, so that that's key, education.
Yeah, and I like what you said about they have to own it, because we can do everything we're taught to do, but if they don't do their part, we're never going to see results.
I think I need like a necklace that says on one side is just maybe like a pretty lily or something, and on the other side you turn it over and it says, "Help me help you."
I
But I
love
can't do it by myself. I'm not going to go live with you. Sorry.
So you've had extensive time to play with CDO therapy and utilize that resource for your patients. If you were to choose a lymphedema patient to use that with, what precautions do you recommend taking with those folks?
With the CDO?
Yes.
You've got to protect that skin from drainage. So using a good skin protectant sealant, and it might be a couple of them. And then educating the patient about the unit. You've got to keep it charged. You've got to keep it on and keep it connected. It's simple. And then just with the compression, the nice thing about the CDO is that the tubing is so small. I'm a big proponent of using foam under short stretch bandages. And we've got some rolled foam, or they might have the full kit and caboodle with a gray foam sandwiching. But if you just take that tubing and place it on the outside of the foam, you can put it underneath the short stretch compression wrap, no problem. But, you know, padding, making sure that it's going to stay with them. That the new units that have the straps that can go onto their legs makes it so nice and easy. Some people worry about having a big long cord, big tail that they might trip over. And the new units provide a really easy way to do that. And I love the charge packs too, so that they're not tethered to a wall. I use a lot of negative pressure, and I love me some negative pressure, but every once in a while they've got to plug themselves into the wall and hang out there with the unit. So that's a really cool advantage in having that easy micro USB port that they could, if you got one of those laying around and you forget your charger, you know, you can plug yourself into the wall. So.
I also like to think about with lymphedema or folks that require wrapping, you know, considering how often they're coming in, because
Right.
we do see an increased amount of exudate with those patients.
Right.
And so, you know, if you're wrapping them once a week, it might not be a good idea for CDO therapy versus somebody who's getting wrapped 2 to 3 times a week.
Right.
That's a great person to
And typically, when they have wounds that we're trying to heal, they shouldn't be a 1 time a week wrap, because that wound needs addressed. If they've got that much swelling, they're going to reduce and need to be rewrapped so that the compression shrinks with them and that we can address the wound. So yes, definitely the frequency of dressing changes and compression wraps dictates that. And usually when you've got a patient who's so stable with their edema that they only need a once a week wrap, I don't know that many of those would have a wound, because if they only need it once a week, their edema is pretty much reduced, in my opinion. So.
Well, with that in mind, I appreciate you coming on with me this morning. And in the spirit of lymphedema, I'm going to say that this is a wrap.
That's so funny.
I like to
Thanks so much for your time. I appreciate all the advances that biotech does and in the wound care and edema world. It's awesome.
Well, thanks so much. And we will see you folks who've been watching a few more times for some more Coffee with Clinicians. Cheers.
Cheers.